Nursing process. 50 questions and answers with rationales. Part 1. Question 1. What is the primary purpose of the nursing assessment? The options are: A. To identify the patient's medical diagnosis. B. To gather information about the patient's physical, emotional, and mental status. C. To formulate nursing interventions. D. To determine the patient's prognosis. The answer is B. To gather information about the patient's physical, emotional, and mental status. Rationale. The primary purpose of nursing assessment is to collect comprehensive data about the patient's health status, including physical, emotional, and mental conditions, to guide the nursing diagnosis and care plan. Question 2. During the planning phase, what is the nurse's priority? The options are: A. Identifying nursing interventions. B. Setting measurable patient goals. C. Collecting subjective data. D. Completing documentation. The answer is B. Setting measurable patient goals. Rationale. The planning phase involves setting measurable and achievable goals for the patient based on their assessment and diagnosis. Question 3. Which statement best describes the nursing diagnosis? The options are: A. It identifies the patient's disease. B. It is the same as a medical diagnosis. C. It is developed by the physician. D. It focuses on the patient's response to actual or potential health problems. The answer is D. It focuses on the patient's response to actual or potential health problems. Rationale. Nursing diagnoses focus on patient responses to health conditions rather than identifying a specific disease. They guide nursing care interventions. Question 4. Which of the following is an example of an appropriate nursing diagnosis? The options are: A. Pneumonia. B. Risk for impaired skin integrity related to immobility. C. Appendicitis. D. Fractured femur. The answer is B. Risk for impaired skin integrity related to immobility. Rationale. Nursing diagnoses address the patient's responses to health issues or risks, not specific medical conditions such as appendicitis or fractures. Question 5. Which of the following is a subjective data collection? The options are: A. Blood pressure reading of 120/80 mmHg. B. Temperature of 100.4 degrees Fahrenheit. C. The nurse observes swelling in the patient's leg. D. The patient states, "I feel anxious." The answer is D. The patient states, "I feel anxious." Rationale. Subjective data includes the patient's personal feelings or statements, whereas objective data includes measurable signs, like vital signs. Question 6. When should a nurse perform a focused assessment? The options are: A. After a change in the patient's condition. B. During the planning phase. C. Only when implementing the care plan. D. When the patient is first admitted. The answer is A. After a change in the patient's condition. Rationale. A focused assessment is performed when there is a change in the patient's condition or to assess a specific area of concern. Question 7. A nursing student is asked to prioritize care for a group of patients. Which patient should be seen first? The options are: A. A patient requesting assistance to the bathroom. B. A patient with a blood pressure of 140/90 mmHg. C. A patient scheduled for discharge in 2 hours. D. A patient who is experiencing shortness of breath. The answer is D. A patient who is experiencing shortness of breath. Rationale, airway, breathing, and circulation, ABC, are always the top priorities. The patient with shortness of breath should be seen first. Question 8. Which step of the nursing process involves implementing interventions? The options are A. Assessment, B. Diagnosis, C. Planning, D. Implementation. The answer is D. Implementation. Rationale: the implementation phase is where nursing interventions are carried out to help the patient meet their goals. Question 9. What is the main purpose of evaluating a patient's care plan? The options are A. To assign blame for unmet goals, B. To discontinue the care plan, C. To complete the documentation process, D. To determine if goals have been met and modify the plan as necessary. The answer is D. To determine if goals have been met and modify the plan as necessary. Rationale: evaluation determines whether the patient's goals have been achieved and allows for changes to the care plan as needed. Question 10. In which phase of the nursing process does the nurse prioritize patient problems? The options are A. Assessment, B. Diagnosis, C. Planning, D. Implementation. The answer is C. Planning. Rationale: in the planning phase, the nurse prioritizes patient problems to focus on the most critical health issues first. Question 11. The nurse is reviewing a care plan and realizes that the patient's pain level has not decreased after implementing the pain management interventions. What is the next appropriate action? The options are A. Document that the intervention failed, B. Ignore the issue as pain is subjective, C. Discontinue the care plan, D. Modify the care plan to include different interventions. The answer is D. Modify the care plan to include different interventions. Rationale: if an intervention is ineffective, the care plan should be revised to include alternative approaches to meet the patient's goals. Question 12. What is the first step in the nursing process? The options are A. Assessment, B. Diagnosis, C. Implementation, D. Evaluation. The answer is A. Assessment. Rationale: the nursing process begins with assessment, where data is gathered to inform the diagnosis and subsequent steps. Question 13. Which nursing action occurs during the diagnosis phase of the nursing process? The options are A. Setting patient-centered goals, B. Evaluating the patient's progress, C. Identifying actual and potential health problems, D. Implementing the nursing interventions. The answer is C. Identifying actual and potential health problems. Rationale: during the diagnosis phase, the nurse identifies the patient's actual or potential health problems based on assessment data. Question 14. The nurse is prioritizing care for multiple patients. Which patient should the nurse assess first? The options are A. A patient complaining of a mild headache, B. A patient who is anxious about discharge, C. A patient with a blood pressure reading of 120/80 mmHg, D. A patient with a respiratory rate of 32 breaths per minute. The answer is D. A patient with a respiratory rate of 32 breaths per minute. Rationale: a respiratory rate of 32 indicates respiratory distress, which requires immediate assessment and intervention. Question 15. A patient's care plan includes the goal, Patient will ambulate 100 feet 3 times per day with minimal assistance by day 3 of hospitalization. What is the nurse's responsibility during the implementation phase? The options are: A. Assist the patient with ambulation as needed. B. Evaluate the patient's ability to walk 100 feet. C. Diagnose the patient's ability to ambulate. D. Modify the care plan based on the patient's progress. The answer is A. Assist the patient with ambulation as needed. Rationale: during the implementation phase, the nurse assists the patient in achieving the set goals, such as helping the patient ambulate as needed. Question 16. Which statement best describes the role of critical thinking in the nursing process? The options are: A. It is only used during the diagnosis phase. B. It ensures that the nursing process is applied in a linear manner. C. It allows nurses to adapt care plans as needed based on patient responses. D. It guarantees that the nurse will make the right diagnosis. The answer is C. It allows nurses to adapt care plans as needed based on patient responses. Rationale: critical thinking enables nurses to adjust care plans based on the patient's condition and responses, promoting individualized care. Question 17. Which of the following goals is written correctly for a care plan? The options are: A. The patient will understand the importance of taking medication. B. The patient will walk 30 feet with a walker by the end of the shift. C. The patient will improve in ambulation. D. The patient will increase strength. The answer is B. The patient will walk 30 feet with a walker by the end of the shift. Rationale: goals should be specific, measurable, and time-bound. Walking 30 feet with a walker by the end of the shift is clear and measurable. Question 18. During which phase of the nursing process does the nurse establish priorities and goals? The options are: A. Assessment. B. Diagnosis. C. Planning. D. Implementation. The answer is C. Planning. Rationale: in the planning phase, the nurse prioritizes nursing diagnoses and establishes goals to address the patient's needs. Question 19. Which example of data collection is classified as objective? The options are: A. The patient reports nausea. B. The patient complains of fatigue. C. The patient states, "I have a headache." D. The patient's heart rate is 88 beats per minute. The answer is D. The patient's heart rate is 88 beats per minute. Rationale: objective data is observable and measurable, such as vital signs. Subjective data refers to what the patient reports. Question 20. The nurse is caring for a patient with diabetes who has been non-compliant with their diet. What should be the first step in addressing this issue? The options are: A. Punish the patient for non-compliance. B. Educate the patient on the importance of diet in diabetes management. C. Consult with the physician for a different medication. D. Ignore the non-compliance since the patient is stable. The answer is B. Educate the patient on the importance of diet in diabetes management. Rationale: the nurse should provide education to the patient to help them understand the importance of adhering to the prescribed diet. Question 21. The nurse evaluates that a patient's wound has healed as planned. What is the appropriate next step? The options are: A. Create a new nursing diagnosis. B. Continue with the same interventions. C. Discontinue the care plan for wound care. D. Discharge the patient immediately. The answer is C. Discontinue the care plan for wound care. Rationale: once the patient's goal is met, the specific care plan for that problem can be discontinued. Question 22. During the evaluation phase, what does the nurse determine? The options are A. If the care plan needs to be modified. B. If the patient's medical treatment is effective. C. Whether the nursing diagnosis is correct. D. Which interventions need to be implemented. The answer is A. If the care plan needs to be modified. Rationale. The evaluation phase involves determining whether the patient's goals have been met and whether the care plan needs to be modified based on patient progress. Question 23. A patient with heart failure is experiencing shortness of breath. Which nursing intervention is a priority? The options are A. Weigh the patient daily. B. Position the patient in high Fowler's position. C. Encourage fluid intake. D. Teach the patient about heart failure management. The answer is B. Position the patient in high Fowler's position. Rationale. Placing the patient in a high Fowler's position helps improve lung expansion and breathing, making it the priority intervention for shortness of breath. Question 24. Which of the following is considered subjective data? The options are A. A blood pressure reading of 127/82 mmHg. B. A pulse rate of 78 beats per minute. C. The patient reporting "I feel dizzy." D. The nurse observing that the patient's skin is pale. The answer is C. The patient reporting "I feel dizzy." Rationale. Subjective data refers to information reported by the patient, such as feelings of dizziness, while objective data includes measurable findings. Question 25. A nurse is formulating a care plan for a patient with chronic pain. Which of the following would be an appropriate short-term goal? The options are A. The patient will be pain-free by discharge. B. The patient will attend a follow-up appointment in 3 months. C. The patient will reduce the use of pain medication in 6 months. D. The patient will report a pain level of 4 or below on a scale of 0-10 within 24 hours. The answer is D. The patient will report a pain level of 4 or below on a scale of 0-10 within 24 hours. Rationale. Short-term goals are specific and achievable in a brief period. A pain level reduction within 24 hours is measurable and time-limited. Thanks for watching. For more videos, please subscribe to this channel. You may share the video with your friends. Don't forget to click the thumbs up and you may leave a comment for the next topic questions practices.